The reason why urinary incontinence can be so disabling is partly because it's progressive till a point in time when you understand that you cannot control it anymore. Before that, perhaps you were getting a lot of frequency of urination, sometimes urgency, and would not know how to handle that moment when there was a compelling desire to pass urine. And beyond all this, one fine morning, you suddenly find yourself on diapers or an emergency created by you where you did not know how to handle this urinary incontinence story. So it can happen to men, it can happen to women, it can happen to elderly more frequently than youngsters. And the capability of able to reach the toilet is different for different people at different points in time. Elderly people who wake up at night have difficulty in reaching the washroom only because uh, the dynamics of their health, their capabilities, their physical activity, the arthritis, the Parkinsonism, the switching on of lights, the help available, all may be completely different compared to daytime, where they could be probably able to take a stick and reach to the washroom. So incontinence of urine brings about a disability that sometimes you can't even speak to your doctors. And more so, you don't know which doctor to speak to. So in the situation of incontinence of urine or leakage of urine, which happens in men and happens in women, your urologist is keen to help you out because this is a progressive lifestyle phenomena which can only worsen if you postpone it. And postponement, sadly, is a rule in a lot of quality of life diseases. The classical is this. Similarly, what happens in recurrent urinary tract infection is you get an acute episode of infection. The infection is severe. You need help both symptomatically to come out of this symptoms of burning, discomfort, pain, sometimes even fever, urgency, and strangery. On the other side, you may forget that you have not treated the cause yet. So use of antibiotics, use of smoothing agents and giving you soothing effects in the urinary passage probably takes care of you, you get cured, and then you forget that there was a cause which brought about all the agony. So the cause in your recurrent urinary tract infection could be similar, where we need to identify the cause, which again is different for different individuals. In women, in men, in elderly, in people who have got prostate issues with obstruction, as much as in stricture urethra. So I think it is important for us to be hope that quality of life diseases in urology are many. These are the most common quality of life diseases which men, women, aged people, youngsters all suffer, where urine suddenly will not listen to you. While you were master all your life, the bladder suddenly becomes a master and decides to contract, give you a sensation which is untoward and which is unpleasant completely in a location where you are in. And therefore, incontinence of urine is something which needs to be sorted out. There are evaluations, there are medicines, there are question and answers, and there's a discussion about how you manage your life during those sessions. It helps us to evaluate you. Apart from that, the medical examination and uroflowmetry, a sonography, gives us an idea that you are in a place from where we can revert you with medications alone. Don't forget, for a very refractory kind of situation where overactive bladder is not listening to medicines, there are treatments available in which botulinum toxin as a minimally invasive therapy brings about the excessive contractions of an insane and an overactive bladder. So incontinence of urine can be because of many reasons. And the reason that we need to know is to probably describe our agony to our doctor in time. Therefore, a urologist is a friend for all those who have got incontinence of urine. And at the Kokilaben Hospital and Department of Urology, very early in the morning till late in the night, people come adjusted to urinary incontinence or urinary leakage and then tell us a story from which we handhold the journey of getting them forward and recovering them completely. So it's important not to live with incontinence, but to leave incontinence, forever, to leave diapers forever, to lead a life which is more confident and where there's no worry about you coughing and leaking urine. You need to wear diapers. You need to look at your toilets. You need to look at beverages. You need to look at a situation where there is a secondary overactivity as a result of bladder being obstructed. It's time to wake up to this phenomena of incontinence of urine and see your urologist in your cities around and getting it sorted out completely. Thank you.